Welcome, everyone. I'm Dr. Maurice Franklin, member of 100 Black Men Health and Wellness Committee, and we're so excited that we have all of you here tonight. Tonight, we're going to be having our second discussion around prostate care and wellness. I want to begin by just talking a little bit about what the 100 and our focus around health. 100 Black Men's goal around health and wellness are to raise awareness and provide access to health care and to give health information that will ultimately promote health and change behavior in our community, save our lives. As we know, in many cases, is when America gets a cold, Black America gets pneumonia. And so one of the goals of 100 is to become that wealth and wellness group in our communities all across the United States. And so tonight, we're going to have the second phase of our conversation around prostate care. Last week, we talked about stages and health information before you're diagnosed. And this week, we're going to spend some time talking about what to do after diagnosis, the readiness, emotional readiness, information from a urologist, and certainly from the survivor's perspective. And so we'll give you opportunities to ask questions. You can put your information and questions in the chat as this conversation, because this is going to be a conversation tonight, as this conversation goes throughout this next hour. And we hope that we'll be able to engage, to inform, to educate, and perhaps to motivate you to move if you've not done PSA. I'm going to start with the video, and then after the video, I'll begin to introduce our panelists and we will begin.
Dear Black America, we love
Some of you may know me from playing 14 years in the National Football League, winning 3 Super Bowls with the Denver Broncos and the Baltimore Ravens. I'm also the 267th member of the Pro Football Hall of Fame. Some of you may know me from being a co-host of Skip and Shannon Undisputed. But what you didn't know is I'm a prostate cancer survivor. And thanks to early screening and early detection, I was able to beat this disease. There's a 96% survival rate thanks to early screening and early detection. I'm a part of that 96%. I started getting screened in my early 30s because of my family history. My dad died at the age of 39. He had 2 brothers that barely made it to the age of 50. And me, being unafraid, I knew it could possibly save my life. And it did. Black men, I'm encouraging you, with September being Prostate Cancer Awareness Month, it's time for you to talk that talk. Go visit your doctor. It could possibly save your life. I'm Shannon Shaw. Some of you may know me from playing 14 years in the National Football League, winning 3 Super Bowls with the Denver Broncos and the Baltimore Ravens.
Very good. I will start with the introduction of our panelists. Our first panelist is Randall Birch. Randall grew up in Brooklyn, New York. He attended Xavier High School and received a basketball scholarship from Long Island University, Brooklyn campus. He's worked as assistant programmer for over 20 years and is in the field of publishing, banking, and healthcare. Randall is now the owner of a real estate management and home remodeling company in New Jersey. He's also a member of the Prince Hall Masons of the state of New York. He's a member of the Board of Education in Somerset County Vocational High School. Is also a member of the Black Caucus and Somerset County Hispanic Caucus. I'd also like to introduce Brother Dr. Edgar Hobbs. Dr. Hobbs is a trained cultural psychologist, a mental health counselor, a published author, a therapeutic crisis intervention trainer. He holds a master's of education from Long Island University and a doctorate in culture and human behavior from California School of Professional Psychology. He's dual licensed in mental health counseling and school counseling. He has over 25 years of experience in providing mental health counseling to school counseling. And in 2011, he received a Guidance Counselor Recognition Award for outstanding service to students and families. He's also a member of Prince Hall Masons, NAACP, and Omega Psi Phi fraternity. We also have Dr. Omodele Alamide. He is currently a urology resident at Mount Sinai, New York. He grew up in Katy, Texas. I know something about that, Dr. Alamide. Before attending Columbia University, where he studied chemical engineering. He went on to earn his medical degree from the Icahn School of Medicine in Mount Sinai and graduated in 2020 to help with COVID relief. And also he helped with COVID relief efforts. Since entering medicine, he's been interested in decreasing health-related disparities for underrepresented communities. Welcome, Dr. Alamide. We also have returning with us this week is Dr. Maurice Henson. Dr. Henson is the owner of and CEO of MediRoots Medical Group. It's a telehealth-based primary care practice committed to providing equitable access to high-value primary care. Dr. Henson received his BA in neuroscience from Johns Hopkins University, his medical degree from Drexel University and College of Medicine, and has completed his residency in internal medicine at New York Presbyterian Cornell Weill Medical Center. And Dr. Henson has a large resume, so we're not going to read it all today, but needless to say, I do want to say this about everyone and all of our panelists. And I said this last week silently, but I want to say this week to everyone listening. Is how good and pleasant it is for brothers to be dwelling together in unity, but it's also just as a doctor, it's also very, for me, it's just empowering to see so much Black power in this group and so many Black men committed to our community. And so this is something that we're excited about with 100, our passion for our community. So I want to start this panel discussion with Randall Birch. And Randall, I just, again, would like for you first to begin with just talking about your journey from testing and to care, to treatment, to diagnosis, and to surviving. And then from that, we'll have some questions, but I'd just like for you to begin with your story.
Okay, first, I want to thank my brother Maurice and 100 Black Men, and also another brother of ours who are not here, because if it weren't for him, I probably wouldn't be here having this discussion with you this evening, which I think is extremely important, and that is Brother Calvin Martin. The journey has been a long. First, I want to stress the most important thing is early detection, but more importantly, the consistency in seeing health professionals. That is the key to success, early detection, and having a long journey thereafter. So for me, I was told that my prostate was enlarged about 15 years ago, and I continued to monitor it. And as it started to grow, my general practitioner referred me to a urologist. And then again, constantly checking every 3 to 6 months. And the last time I saw my urologist was December 2019. And at that time, of course, there's always a PSA test. PSA is one of the ways of monitoring the prostate and potential cancer. And everything was fine. And what I mean by fine, I'm not going to get into the technical, the numbers. I think health professionals should do that. But for me, it was in the fine category. And then the pandemic hit. So July 15th, I was not feeling well. It was a situation where I was extremely tired and out of breath. So went to the emergency room. Everyone thought COVID, had a COVID test, came back negative, had a chest x-ray. It turned out that I had pulmonary embolism. To the degree, at least health professionals are saying that they don't know why I'm still here. But it was so bad that they needed to find the cause. So battery of tests, full body scan, the works. The only thing that came back was the prostate was enlarged. And so they said, we're still not sure, but we need to find out what's going on here. So I made them aware that my urologist, that I've had, an enlarged prostate for some time, and that my urologist was a physician at that particular hospital, and for them to consult. So was in hospital for about 8 days, went home. First thing that happened was my urologist put me on a antibiotic, he said, because sometimes an infection can increase the number and increase the size rather. And that didn't work. Things were still high. So had a biopsy, discovered that it was exactly prostate cancer. So for me, it was a difficult procedure because having pulmonary embolism, and that wasn't totally eradicated at that time. We were still treating it with blood thinners. And because we weren't sure exactly what was the cause of the clots, we were also concerned about that. So from the time of detection, this was in August, I had the biopsy. I wind up having the surgery in November for a couple of reasons. Number one, they were concerned whether or not it was the right thing to do under the pulmonary situation. It wasn't cleared up. And secondly, I had a lot of different doctors concerned about all of the possible things that could happen. So the first thing I did was look at the different types of treatment. And then I was very fortunate because I think it's one of the silent, it's one of the things that we don't talk about as men, the type of medical problems that we're having. But because of Prince Hall Masonry in New York, I knew a lot of the brothers who had gone down this journey. So I reached out, and the response was unbelievable of the number of brothers who have survived this, who were able to share their experience with me. And this went from radiation all the way to having the prostate removed. And for different reasons. There were different types of cancers I've learned. Some cancers, or maybe it's the stage, but the way it was explained to me, some cancers are more aggressive than others. And the other problem, which is the big thing, is that many of us are not going to our doctors. So by the time it's detected, it's at a stage where it's extremely difficult to treat. And some of us, unfortunately to say, did not make it. But because of the conversations and the different types of experiences, my position was to have it removed. And I chose that route because for me, I wanted a doctor to be able to look and see exactly what was going on with the prostate. And I wanted to know whether or not the cancer had gotten out of the prostate and into other areas, such as the bladder and other areas, that can be affected.
So Randall, right there, I want you to pause because I want to bring in Dr. Olumide to kind of co-talk about this with you. So Dr. Olumide, could you come in right at this point and begin to share around the medical perspective around what Randall's talking about?
Yes, absolutely. First and foremost, just wanted to thank 100 Black Men for having me, and a special thank you also to Dr. Miller for trusting me to be the urologic source here. So yes, Mr. Birch brought up a few things. First, I'll kind of start with the fact that you can kind of think about prostate cancer in terms of like two categories. One, your localized disease, where it's located in the prostate, and then you have your kind of like advanced stage disease or metastatic disease, which is what everybody is trying to essentially get patients away from. And if you think about it in those two categories, you can say with your localized disease, your 5-year survival is close to 96, 98, almost 100% if you get it treated. Even your 15-year survival can be upwards of 90%. But if you look at the, metastatic or locally advanced disease, kind of prostate cancer, wherever it's spread outside of the prostate, that's where you kind of see your 5-year survival of maybe like 30%, right? So, I mean, you can see how drastically those two pathologies are and how drastically your medical management and treatment might be, and also your outcome. So, I mean, yeah, just to kind of take people through the way that a urologist kind of thinks about these things. So, one of the first tests that we get, which we mentioned on the call last week, is your PSA, right? And based off of your PSA, we can do a little bit of a risk stratification to put you into like a high risk group, maybe an intermediate risk group, and a low risk group. And then, the definitive diagnosis that we always look for and try to get is based off of a biopsy. And the biopsy really helps us to really stage you into those 3 groups. If you're in this low risk group, most urologists will kind of usher you, or at least encourage you to just, what we call active surveillance, which is essentially we'll get repeat PSAs over time. We might get repeat biopsies over time, but we're just watching the disease, thinking that, with the, as Mr. Birch also alluded to, some of the side effects of the treatment can be terrible, in all honesty, for men. So, there's this idea that, okay, if we can watch the disease, we can buy you some time, and maybe, a large proportion of these patients won't actually need definitive treatment in the long term. So that's the benefit of that. If you're in this intermediate risk group, that's where you start to think about your focal or local therapies, right? So you can do a prostatectomy. Sorry about that. So you can do a prostatectomy. Typically most people offer like a robotic approach these days. You can do radiation. You can do focal therapy, which is in the form of like cryoablation or like microwave ablation. And then you can also think about even doing some androgen therapy at that point too. But androgen therapy is really more so for your high stage, almost metastatic disease at that point. And then in that high risk group too, that's where you kind of think about your androgen deprivation therapy and then also your radiation. So one thing that, is very important and is a big question that, urologists always get is, what are the side effects of the treatment? Which treatment will be best for me? This is where the discussion really kind of boils down to, and where, patients in all honesty will always have these type of questions, which is completely reasonable. And I think you need great physicians to kind of guide you, and you really want to be able to trust your physicians and align whatever your treatment goal is with the treatment that is provided. So there's ways that people like to think about this. So let's just say you're intermediate risk and all of the treatment options are available to you. Some men will say, I just want the prostate out. I don't really want to deal with this anymore. I just kind of want to go with that. Other men will kind of say, I can maybe do radiation. I don't want to have to go under surgery. It can be really, mentally burdensome. It can also be physically burdensome. I don't want to deal with that. I'll just do radiation. So if you're thinking about prostatectomies and just the surgical approach, you're thinking in the short term, that's when you're going to see your complications, right? And the biggest complications here that men really worry about is, one, the erectile dysfunction. And then secondly, the kind of like incontinence that they get to, just based off of us having to kind of resect close to the bladder. And incontinence is just, your leakage of urine, whenever you cough, whenever you sit down, as you move around and such. So whenever you do a surgery, that's in the acute setting, right? And typically over time, you see that those complications actually start to improve, right? So you'll start to regain some of your erectile function. You'll start to regain some of the, muscles that provide that strength for your incontinence and stuff. Whereas radiation is almost the complete opposite, right? In the short term, you probably won't lose much just getting, radiation to the pelvis. You won't really suffer from erectile dysfunction. Very rarely do you see that. And incontinence rates are very, very low too, less than probably like 10% in the first 5 to 10 years. But in the long term, that's when you really start to see some of the effects of the radiation. And those things, including the erectile dysfunction and incontinence, can be things even as severe as like secondary malignancy. So radiation has a risk of also increasing your, I guess, like risk of another kind of disease or cancer in the future, right?
So Dr. Olumide, I'm going to bring in our third vice president, and then we'll get back to, we'll have questions, but I want to bring some others into this discussion. So we have our third vice president of 100 Black Men, Terrence Brierson, and Terrence is an active member of the Harlem community. He's been focused on raising awareness and health issues as they affect Black and Brown communities. Mr. Bryson is a program coordinator for Neighborhood Network. Brother Bryson, do you want to come in and that's part of the conversation? I'd love to hear your perspective.
Yes, how you doing, everybody? Good evening. Yes, I was diagnosed with prostate cancer in 2013. My doctor called me. She said that my PSA level was 7. She said, I made an appointment for you to go see a urologist, I believe, at back then the hospital was called St. Luke's, at St. Luke's Hospital. So I went in, did the appointment, he did the biopsy, came back and said, yes, I did have prostate cancer. I went to 3 doctors. I got 3 opinions, 3 different doctors, 3 different opinions. One of them wanted me to do the radiation. One of them wanted me to do something called a cyber knife, I believe. And then the last doctor, which I went to was, he told me everything. He didn't even tell me what to do. He just gave me the pros and cons of everything. And I picked the prostatectomy. So he took my prostate out. So I did my research on the doctor as well. So when I did my research on this doctor, I found that he's probably one of the best, not only in the city, but in the world. And if you doctors know, his name is Dr. David Samadi. He was the one that did my, took out my prostate. And they explained to me, because the reason I went with him, we had a long conversation. My wife was with me at every point of the way, but we had a long conversation. And he sat down and he talked about, how Black and brown men feel about getting their prostate taken out because of the incontinence and the impotence. He also said that, like the doctor said earlier, it will come back, which it has. It definitely has come back. And he said, it's based, a lot of times it's based on the expertise of the doctor, the way the incontinence is. He said, if you went to a doctor that did 500 surgeries a year, and then you went to a doctor that did 5,000 surgeries a year, that one would probably have more experience. So I'm just listening to everything that he was saying, and I picked to have it taken out. That's what me and my wife, we made that decision. And he said it was in 47% of the capsule. That's the word that he used. So he took it out, it was 47% of the capsule. I had the surgery the day after. I always remember when I had the surgery because it was a Tuesday after the Super Bowl that was here in Giant State. So that's how I'm always remember that. So that was 8 years ago. That was 8 years ago I had the surgery. I go see him when I first had the surgery, I had to go see him every 6 months. Now I see him once a year. And he's not even on my insurance, but I make sure I get that $250 to go see him every year to do another test, to test it out. So far, knock on wood, it's been 0.00% undetectable. And I try to talk to a lot of brothers about this because we do worry about our masculinity, but like my wife said, she'd rather have an impotent me, a live impotent me, than a dead not me, So your family really means a lot to you as well. Like when I went to have my surgery, I had about 25 people in the room before we had the surgery. And another thing I liked about Dr. Samadi is that right before we went into the funeral, right before we went into the surgery, to have the surgery, my family, we did a prayer. And everybody was like, hope I come out, yada, yada, yada. And the doctor said, pray for me too, which meant something to me, which means that he don't think he's God, which means that he's human as well. And he did a fantastic job. So I always want to make sure, brothers, that it's okay and get that digital test as well. A lot of times people say, ain't nobody sticking their finger up. No, it ain't about that. It's about you being healthy. And it's about you being safe. If it's going to save my life, by all means, you can get that test done. That's a lot of us guys are afraid of that. And I try to spread the word about prostate cancer every time I'm in front of a group of Black men. You can ask Anthony, who's my son, by the way, if you already know, but you can ask him. Unfortunately, every time we have a funeral, when I say whatever I'm saying about that person that just died, I also do that public service announcement as well to get that prostate checked. Because like somebody alluded here earlier, I forgot who said it, but sometimes you wait too long. That you know how I had to do it. I got it because I take my physical every single year, and I have my medical doctor put the PSA in the blood test. A lot of times, I think you have to ask them to put it in, but they'll take your blood test and say your cholesterol is this and your sugar is this, but they never say what your PSA is. So every single time that I go to the doctor, and I've gone to the doctor, I go every single year, make sure that PSA is in there. So
that's a great segue. I just wanted to spend some time talking about a support network and the importance of being able to bring your family into that situation. So I want to get Dr. Hobbs into this conversation now as we begin to talk about sort of that mental health component. And Randall, I would like for you to be able to share after Dr. Hobbs around that connection between your support group, the advice that you might give to others. So Dr. Hobbs, what would you like to say in regards to that support network and sort of the mental health component of this?
Thank you, gentlemen and ladies out there. So I wanted to talk about what happens mentally after the diagnosis. We talked about the physical, right? So what happens mentally? So what I want to talk about is the different stages that we actually go through regarding that. Kubler-Ross did the 5 stages of grief, the 5 stages of death and dying, but we're not here to talk about death or dying. We're here to talk about life, right? So I wanted to take a moment to share the screen with you and go through these different stages regarding that. Can everyone see my screen?
Yes.
Okay. So what I talked about is what are the stages mentally that we go through. So after hearing this diagnosis, I'm sure people have experienced like that prostate, you're in a state of shock. You're like, what? You go through this and you think about it like, this can't be, which leads into denial. It's like, no, this is not possible, or whatever may happen. And this doesn't happen like very quickly, but sometimes it can. These stages can go really quick and go really slow. It depends on the person, but it depends on how you are mentally, how you are handling this information. Of course, you can get angry about it. You're like, this is, this, we'll say these expletives, we'll, get mad at the doctor, and we'll get mad at ourselves. And so, so we try to find different ways to deal with that. And, so we're looking at bargaining, right? So we're looking into, okay, how, can I eat differently? Do I, what can I do? Tell me. And, I don't want the surgery, I don't want this to happen, and then, sometimes things are inevitable, right? And so you go into this state of depression where you get sad about it. And then you start to say, well, okay, let's do the test. Let's see what it is. Maybe it's not. They just diagnosed me, but maybe it's not. Let's do a second opinion, third opinion. Hearing brothers on last week and this week about, let's do the test and let's find out. And so we don't really get to the full acceptance until we accept what is actually happening. And so once we get there, we say, okay, well, if I have to have the surgery, I have to do other things, then I'll do it. And then it starts over again, because now it's like you're looking at changing your lifestyle. You can say, oh, I can't do this anymore, or I have to do this a certain way, or it can't be. And you'll go through these different stages again till you get to a point of, actually accepting a new lifestyle, a new way of living. I'm sure if I ask brothers that they go through these stages, they probably, I might get, mostly all the brothers that might say that who have gone through this. And so, going through that and thinking about it is, how do you cope with this? What are ways to cope with, how to deal with this? Face your feelings, express your feelings in a tangible way. Of course, go running, boxing, things of that nature. Hear people praying about it, right? Try to maintain your hobbies and interests. Don't let people tell you how to feel. Don't tell yourself how to feel. Things just come natural. Sometimes, it just has to take its natural course, right? But continue to look out for your physical health. Plan ahead for those grief triggers. Okay, you can't eat certain things anymore, during the holidays that might happen. And so you can't do certain things at a certain time where you see other people do. So being prepared for you to do these particular things. That's what I want to convey. Like mentally, you go through a process, but at the end, you come out on the other side and you start to realize and you appreciate life and you understand certain things. So with that being said, I'm gonna stop it there.
Thank you for that, Terrence. And well, let me start with Randall first, and just in expressing sort of the emotional range that you went through from diagnosis to treatment. What did you experience, and how did you work through that?
I can honestly say for me, I didn't go through a wide range of emotion because education is the key. I knew that this was something that could have been in my future. The only concern I had was method of treatment. And that's where my community helped. I was totally surprised at the number of people who had gone through this experience and did not share it. I did find out some people even close to me had the experience, but all of these individuals, all of these brothers had, without me really confirming, but they had a radical form of cancer. For me, it's possible, my takeaway was they may have gotten to their health professionals a little too late, and maybe it wasn't really, monitored. So they did not have a choice in selecting their method of treatment. They all had to have the prostate removed. And from that, there was a wide range of experiences, some good, some not so good. And the key for me was, number one, quality of life. And for me, that meant I did not want to live with the concern that the cancer, the radiation did not, eradicate, or that cancer got outside of the prostate. So for me, having it removed was the only option. And from there, I'd move forward to try to select the best possible surgeon with the most experience to get the job done. I can't stress enough the importance of the prevention, and that is, having the test, not being concerned about your manhood and all of these other things, and not, being able to perform, because if you're not here, you're not going to perform. All of those issues of erectile dysfunction are there, regardless of the method that you choose. But the most important thing for me was to be able to, and I think I said it earlier, having someone look, in that area and see whether or not, everything was healthy. And if not, then get me on the next step of treatment going forward if things moved outside of the prostate and affected other areas. So for me, quality of life moving forward was the most important thing. And that quality did not have anything to do with my ability to function, sexually. It was to live, to be able to, stay here.
Thank you for that response. Dr. Henson, you talked a little bit about, quite a bit about integrative healthcare last week, and we've now got to that phase where we've seen the urologist. We are clear about our diagnosis and our treatment plan moving forward. Where does primary healthcare fit into those stages and into that work plan?
Well, yeah. So I think the shortest answer to that is the need for whole body care doesn't change just with diagnosis. In fact, it's even more so. Illness is a physical, emotional, and mental manifestation of some sort of pathologic disturbance, right? So what we discussed so far is the physical aspects, having the prostate removed, the radiation, that's dealing with the physical element of, having a cancer diagnosis. But there's also the mental and emotional component. And unless you address all of these things in concert, it becomes likely a bit more difficult and problematic to address the physical, right? So, when you consider, the studies that show how someone who meditates is able to reduce their blood pressure, you can see how one element, which is more emotional and mental, relates and has an impact on the physical. And the same is true when it comes to cancer diagnoses as well. And so anytime that someone is diagnosed with anything, any chronic disease, I would always suggest a whole body approach to addressing that disease state.
Thank you, Dr. Henson. Terrence, can you talk about your what kind of a treatment plan are you working with now, and how are you integrating all of these, all this new knowledge that you have?
Of course. Well, my treatment plan basically is to stay fit, go to the gym, and eat right. I do a detox every couple of months. I try to stay away from red meat as much as I possibly can. Like I said, I go see Dr. Samadi every 6 months, as well as when I go see my PCP. She also does the test just so I can be sure. So, like he said, he took it out. It was 47% of the capsule, so it didn't go anywhere. So basically, I just tried to maintain a healthy lifestyle, a good diet, get some exercise, because we're getting older, and just try to spread the word to every young Black brother, old Black brother, any brother we see, any man of color, to let them know how important it is to, number one, get a physical every year. Because although we're talking about prostate cancer, there's a lot of things that can happen to us where we would say, damn, I wish I went to the doctor last year. So those physicals are very important for everyone on this call. Make sure you go get your physical every year, because it could have been something else.
So do you feel like Randall, do you guys feel like you get, when you're having these conversations with your peers or with younger brothers, do you feel like they're listening? Are you getting any kind of feedback, indication that it's translated?
Oh, yes, they're definitely listening. And this is the thing, is because we've been silent for so many years. It's been our history. We tend to suffer in silence. But if you take out the time, you'll be pleasantly surprised how many people will actually, take out the time to listen. And if you address their fears and their concerns, and enforce the fact that the prevention is really the best possible cure, and that doesn't require much time, and it doesn't even, for the most part, is painless, then they're more apt to not just listen, but to share that information and practice. So that's been the most gratifying part of all of this, is being able to share.
So we about 15 minutes left on this. I do want to get us out on time. So I do want to go around the room one more time. So I'd like to ask our panelists for about 30 seconds, a comment if you have one, and then I'm going to open it up for our audience. And so I'll start with Dr. Lamade, and then we'll go to Dr. Hobbs and to Dr. Henson, and then to Randall, and then to Terrence.
Yeah, I think a lot of great things have been said, especially in the last few minutes, kind of about like the mental aspect of the disease. One thing I want to urge everybody on the call to do is, and everybody's already said it, but to just continue to have these conversations. I feel like sometimes as Black men, we shy away from discussing some of these things. And in all honesty, that knowledge as well, a lot of times, and those shared experiences can be quite beneficial in terms of actually increasing the health equity of the whole group.
Dr. Henson.
So, I'm going to preach prevention, before anything. Prevention is paramount. But at the point of diagnosis, we still need to implement and consider this whole body approach. There are a number of complementary medicines, and again, they use that term sort of specifically because what we find is that there are certain herbal therapies as well, which actually augment the effectiveness of some of the chemo agents. We know that meditation works. We know that these other forms of energy healing work, acupuncture, yoga, all these other forms of energy therapeutics. They work in concert and synergistically with some of our more advanced technologies and therapeutics. So, I would just suggest that, if you do encounter a diagnosis, that's not reason to stray away from the healthcare system, but to embrace the system and, all elements of it, which include mental health therapy, energy therapy, as well as the sort of physical, sort of conventional therapies as well.
Just one question for you, just a follow-up, Dr. Henson. Is there and perhaps is there any data that suggests that even someone with a diagnosis, in terms of their fitness level, is there anything to suggest that they may recover from this quicker? Dr. Olomide, you might perhaps, both of you asked this question, but I'd like to know what the literature says around fitness and and prostate cancer diagnosis among African American men.
So I can't speak intelligently about numbers with respect to prostate cancer, but we do know in general, those who tend to be more physically active tend to have better outcomes. Sedentary lifestyle is one of the risk factors for developing prostate cancer, and it's also one of the risk factors for having complications after treatment. So physical exercise and being physically active is one of the staples of recovery with any disease. And this is why, when it comes to essentially all forms of chronic disease, whether it's high blood pressure, diabetes, obesity, high cholesterol, one of the things that we always recommend is physical activity, increased physical activity. And that's nothing more than 20 minutes a day, 3 times a week of, strenuous walking, getting your heart rate up. So, we're not talking, having to go and run a triathlon in order to be physically fit, but we do have very good data that suggests that a sedentary lifestyle puts us at increased risk for the development of prostate cancer and all cancers and all forms of chronic disease.
Thank you. Dr. Olomide?
Yeah, I completely second everything that was just said. I mean, that's one of the risk factors for the disease is obesity and sedentary lifestyle and such. And then even from like the medical treatment aspect, if somebody's dealing with obesity, hypertension, diabetes, it makes treatment even more difficult. Some of the side effects of the medication, even some of the side effects of the surgery are compounded by having some of those disease processes alongside of things. So.
Thank you. Thank you. Dr. Hobbs, any final comments?
Yes, thank you. I would say don't let fear and anxiety inhibit you from seeing a doctor, getting an annual physical that you need to get. We all need that, and rest assured that whatever the doctor or whoever might diagnose you, to understand that it's for your best interest. And doctors are here to serve. They're here to give you that information that you need to stay healthy, to stay moving forward in life. So if that means changing your lifestyle, then do what is recommended. And also, as someone said before, also not just taking care of your body, but taking care of your mind. Like if you need to, getting therapy for that. I'll leave it there.
Thank you so much. I want to first, before I introduce you again, Randall, just want to thank you so much for coming and sharing your testimony with the members of the 100 and for those members of the community that have joined us tonight. I think that personal testimony is extremely important in our community, being able to share and you've done that and have been doing that, for the last couple of years, and I really appreciate it, and I think that our community is the better for that. Any final words from you, Randall?
Yes, I just think it's also important in reference to, and this was my experience in reference to the treatment. I had robotic surgery, and being an athlete, I've had a lot of injuries and I've had a lot of surgeries over the years to correct different things. And this particular surgery was one of the best surgeries I've ever had. I went in the morning and I was back home that evening. There wasn't a whole lot of pain and recovery and, and pain management or any of those things. To the point where if I had to have it tomorrow, it wouldn't be a concern for me to have to, go in, especially having that experience. So I think that people need to understand that the fear of having surgery is a big thing that I know that a lot of men that I've spoken to over the past couple of years have. And the type of surgery and pain and discomfort that a lot of men think that they're going to have, I want to dispel that. At least that was not my experience.
Thank you, Terrence. Okay, so nothing from Terrence. I do have, I want to turn this over to our chairperson of our committee who has his hands up right now. So Reggie.
So thank you, and everyone, this is a good panel and good discussion. One of the things we haven't talked about, I'm Reg Miller, I'm the co-chair of Health and Wellness with Dr. Gary Butts, faculty member here at Mount Sinai. One of the things we haven't talked about is the genetic component. So can somebody talk about genotyping of prostate cancer as you would with breast cancer, as well as what should a man who has a familial history of cancer, say if your mother had breast cancer, what should you do relative, or what awareness should you have relative to the potential of contracting prostate cancer? But first talk about the genotyping, or the different genotypes as there is in breast cancer, and the consequences of that genotyping.
Yes, I'll chime in just briefly here. So, I think in the last maybe like 10 to 15 years, there's been an association with this like BRCA mutation that you typically see in like breast cancer and men who have prostate cancer too. So, our committee, the American Urological Association, has started to recommend genetic counseling for a lot of these patients who are diagnosed with prostate cancer, especially whenever they have more advanced disease, because there are certain medications that you would give to somebody based off of their genotype that could actually improve their survival compared to those who don't actually have that genotype. So in regards to, there's a few pieces here. In regards to the family history aspect, those are the kind of patients that you want to screen a little bit earlier. So, typically after the age of 40 for the family history, it's recommended to start screening with a PSA. Once you also know that you have like a history of this BRCA mutation or, family member with it, it's something that you want to test for. There's also another mutation, it's called like FGFR3, that also can put you into a different like risk category and also open up other potential treatment options that are like newer modalities. So it's a great question, and there's a lot of new research looking at this kind of stuff.
Yeah, and I'll chime in real briefly also just to follow up. If you recall the video that we saw at the beginning, with Shannon Sharp, he mentioned that he had a strong familial history of it, which impacted his decision to be screened earlier. So again, that's emphasizing the importance of prevention and getting early screening. I just want to emphasize the point that while genetic susceptibility is a real thing, you still need an environmental trigger. All right. So those environmental triggers have to do with the things that we consume, the way we treat our bodies, the decisions that we make. All right. Because just because you have a genetic susceptibility doesn't mean that you'll actually develop a disease. But if you live a life with poor decisions regarding diet, things like that, then the likelihood of you developing the disease increases significantly. But again, if you have a strong family history, that's even more of a reason to get screened earlier.
Forgive me, gentlemen, my internet is acting crazy. I'm downstairs in my house and sometimes it goes crazy. So I've been in and out, but I'm here now.
Dr. Miller, did you want to have any final words? I think we want to show a video, but did you have any final words?
Oh, no. I would like to hear from some others in the audience. I know there's some other folks that have some questions, comments, insights, but no. Thank you.
There was a comment from MJAC in the chat room, so I'd love to hear some perspective from them. They talked about wellness and sort of lifestyle changes.
I see Leslie has her hand up.
Leslie?
Hi, first of all, thank you for this panel. I just happened to check my email about 20 minutes ago and saw this and joined. And I wish I was on the first panel, but I believe this timing is divine. I have assumed a caregiver role for my 70-year-old uncle, who just recently moved in with me. And in the past 45 days, we got him a checkup and his PSA levels were 54. So we got him in immediately to a urologist once we moved him here, and he had a biopsy just this past Tuesday. We're waiting for those results. And I just, as a caregiver, a new caregiver, I think I'm looking for, I really don't know what the different types of treatment are. Not only is he 70, but I believe that he is probably an undiagnosed autism. And back then they didn't diagnose those things, but he has very high tolerance for pain. He never complained, so we had no idea that there were issues that he was feeling. How do I, as a caregiver, how can I prepare for what's to come? What are some of the questions, or where can I find some questions so that I can arm myself intelligently and go in? I don't know what to ask, I don't know what the different treatments are. And for a PSA level of 54, I hate putting that out there, but it just sounds inevitable. So I just want to be as prepared as possible, help him live the best life possible. You talked about the stages of grief, for a 70-year-old man who doesn't really talk much and complain much. I don't even know how to help him navigate that, so we're at the very beginning stages here of something that I think we'll need some support with.
Dr. Alamede, do you want to answer that?
Yes. So first and foremost, I'm really sorry to hear about about this patient. And thanks so much for assuming the role of a caregiver. I know that's not too easy. Just speaking a little bit about the clinical aspect. So with a PSA of like 54, I mean, yeah, it's something that sounds quite outstanding here and on this talk, but it's something that we actually see quite often in practice. That automatically puts you in this high risk group, and almost 50 to 60% of patients with that kind of PSA will have some level of like either metastatic or micrometastatic disease. Just to kind of paint that picture for you. It doesn't necessarily mean that he's going to have like a poor outcome. It more so is a question for you to align your goals, as a caregiver, with the treatment and with the patient, right? So you discuss, some of the things, surrounding his past medical history and such. These are discussions that you should really have with your urologist. But in the short term, I think first thing being first, plug yourself in with a good kind of multidisciplinary team. you don't just need a urologist here. You need mental health counselors. You need preventative, people in like holistic care. You might need a radiation oncologist, and you need a medical oncologist too, because this is now not necessarily just a surgical disease like a urologist would treat, but more so a medical one. I actually want to share my contact information with you if anything, if you have like more specific questions. But the first thing will kind of be to just plug in the necessary people around you that can help you kind of like navigate the situation. I'm really, really sorry to hear that, but I'll actually email you my email or something too, and then we can discuss further offline.
Anyone else want to respond or address that, or go to Rudy Combs if there's Dr. Henson, do you want to say something? Or
Yeah, I can. This is sort of beyond the point where I would be involved, at least in terms of direct decision making. But I think just in general, when we start to consider these types of diagnoses, especially during towards once we get up in age, you kind of have to consider two things. How aggressive do you want to be with this? Or do you want to focus more on quality of life rather than trying to increase the quantity of life? And I think a lot of that depends on you all as a family, him as a patient, and really establishing what goals he has, what sort of personality he has, and then make that decision thereafter. As this is difficult to tell you that you should go one way or another, because it really depends on what he wants and how aggressive he would like to be. I don't have the numbers offhand to tell you what the prognosis is given, this level of PSA, but it all, irrespective of prognosis, is all about what the person wants and what they believe to be the outcome. All right, so that's the biggest determination factor at this level.
thank you. We have a question from Rudy Combs.
Yes, good evening. I'm on the Health and Wellness Committee along with Reggie Miller and other members. But my question is, we talk a lot about the medication and stuff like that. Now, I'm not trying to put one of my colleagues, Reggie Pittman, on the spot, but he is a survivor and he used the holistic way. And I'm trying to, get some ideas, and not just myself, but for people on. And is there other holistic treatments that could be used, say at stage 1, that no one talks about and should be talked about? And that's my question.
Are there any providers who have something to offer in response to holistic care and treatment of non-Western medicine medical treatments for prostate diagnosis?
So this is Mark Jackson. Can you guys hear me?
Yes.
Oh, okay. All right. So I'm the provider located in Florida that made the post earlier. Just wanted to say I'm really happy that you guys are doing this. I think this is awesome. When it comes to, disease processes in general, my little input is that one of the things that I think we've been missing as a community is measuring inflammation, right? Because if you can manage that inflammation level, you manage your risk of all forms of diseases. So I'm talking, instead of, patching the walls when the roof is leaking, let's get the roof fixed so we don't get into the disease in the first place. The other thing I'd say is, in terms of your risk for disease, one of the things you want to look at or try to get an idea of is your gut health, right? How well are you absorbing nutrients when you eat? Because this is going to play a really, really important part in just how healthy can you be and how much help will you need to be at optimum health. As far as, I don't know if you want to say holistic, but I'm a big believer in supplementation. And that's because I don't know if there's anybody in this meeting right now who believes that the nutrition, the food, the fruits, the vegetables and stuff that we have available today is at the level that it was from a quality standpoint, say, I don't know, 30, 40 years ago. So that's just my perspective. I think that we definitely want to look at supplementation because we need to bridge the gap. The food is letting us down. That's a huge, huge issue, right? Second point, we have to stay on top of the inflammation because the inflammation's a direct indicator of, hey, are your antioxidants where they should be or not? Can they protect your cells? And then obviously the third thing is, regardless of what treatments are you doing, are you absorbing that, right? How's the gut functioning? So that would be my little points. I would definitely love to catch up with you guys off the air because I think, you know, from a wellness standpoint, there's so much more that we could talk about.
So we appreciate that. First, drop your email and to our chat box so that we can continue to communicate with you. This is a bridge to the conversation for more conversations. And we actually shared and talked quite a bit about this last week. So I'm smiling because this is a sort of iterative conversation that we've had around healthcare and total healthcare and gut and nutrition. So thank you for sharing that again tonight. Brother Pittman, you want to share?
Yes, I have a question for Dr. Alameda and Dr. Henson. And Brother Coombs already shouted me out. That's fine, man. You know that. So my question is, I've survived prostate cancer for 13 years, and I did it holistically, and I share my information as I did last week. For YouTube, when I went to my urologist, after the biopsy, the holistic approach, he said active waiting, watchful waiting, and I didn't want to just watch and wait. So is a holistic option something that a urologist should do? So I'm going to ask that to Dr. Alameda, and good to see you again. I say at the golf event, and Dr. Henson. Thank you.
Hi, Mr. Pittman. Good to see you again as well. Thanks so much for the question. A holistic approach is completely reasonable. Like, I don't think anybody should tell you it's not. Especially for those patients in which, you know, they're low risk, even favorable intermediate risk, and you can talk to your urologist about what that means based off of, you know, lab values and such. Those patients do very, very well on active surveillance with, you know, 15, 20-year, you know, disease, we'll call it disease progression survival of like, you know, greater than 95%. So I definitely think there's a role for it. I think there has been a lot of like, you know, more research in it in the last few years. Nobody's really targeted a like, you know, consistent regimen, but there are a lot of new things kind of in the works about this and around this. And, you know, I would urge most patients who kind of, you know, want to pursue that to really talk to the urologist about it.
Thank you. We did have a question in the chat room from Andrew Scott. He wanted to know what is the standard or normal PSA number. And Dr. Alameda, I know you answered it in the chat room, but could you go ahead and answer that for the entire group?
Yeah. So there's really no standard or like normal PSA value. It kind of depends on the size of your prostate, how old you are. There are other things that can kind of falsely elevate it if you have a catheter, if you know, have some kind of trauma to that area and such. So there's no standard value. What we kind of have decided as urologists is, you know, a cutoff of 4 is kind of what we use in terms of saying, okay, this person should undergo a biopsy or not. And even with, you know, I mean, you'll see patients with really high PSAs, greater than 10, some greater than 20, and they'll have a biopsy and it'll be completely negative, right? So there isn't any, you know, PSA is kind of just a screening marker. It doesn't really give you a sense of if you have, you know, any kind of disease or anything.
Okay, we'd like to entertain any other questions that you may have. Okay, I'd like to turn this over to our co-chairs, Dr. Miller.
So again, I just want to thank you all for participating. The Health and Wellness Committee is all about improving health literacy of our community. And this is just one of our efforts to do so. I do want to acknowledge Dr. Dara Cass, who's on the call. Dr. Cass, could you tell the group who you are and what you represent briefly?
Sure. I was actually curious how many text chains were like, who's this girl? Why is she here? So I am Dr. Erica. I'm actually the regional director for the Department of Health and Human Services, and actually have been entirely impressed with this conversation. I'm actually an emergency medicine physician as well. I spent my career working in New York, most recently at Columbia, then NYU before that. I've actually never worked at Mount Sinai, which was a conversation we had at our first call. And I was really privileged to listen to this call. To be honest, I want to reiterate that the sharing of patient stories, especially in communities from community members, is the most effective way we can see change amongst our friends and family. And so really the bravery of you all talking about a topic that is taboo, and especially for men, especially for Black men, but especially for every member of our community who has to be vulnerable. So I just want to applaud the patients who shared their stories. I am sorry my son jumped in. It's like 7:30 here in New York and my kids are used to me being off the computer. But again, I wanted to just reiterate the advice you guys got, the personal touch, the fact that you got phone numbers for family members that are now undergoing new diagnoses. It's a really remarkable group you have here, and I hope to join you another time.
Could you just briefly mention Health and Human Services and what you all are doing around this topic?
Sure. So the Department of Health and Human Services is the federal department that governs all of healthcare and human services. And specifically around cancer, the president's, one of his main priorities his whole life has been to eradicate cancer. That the cancer moonshot is his big dream to really fund research and move forward so that there is not just research that is effective but equitable. So one of the things that's happening right now is really a move towards intentional equity in research for all cancers so that the treatments match the patient populations. Health and Human Services covers HRSA, which is our federally qualified health centers, CMS, which is Medicare and Medicaid services, and many other of the services that the federal government supports to get to the state, and then the state brings it to communities. And I'm here to be a partner with you guys in anything that you're doing. I am, like I said, impressed with this group, and we will continue to work together on more projects, specifically as it relates to outreach in the community to make sure that patients and providers are getting what they need.
Well, I want to thank you again for partnering with us and also for spending this time. I know you got to go spend some time with your kids, but we're glad to see you here. And it's important for folks to just understand the type of support and partnerships that we're developing around this topic. And then the final thing for me, and this is not the takeaway from anyone, but I want to give a shout out to Dr. Olamide. This is the future. This brother's PGY3.
Yes, I am.
So he's still in his training, but you see how his depth of knowledge. But this is the fellow who's going to be doing the research, doing the treatments, and working on the cures for the future. And that's why it's so important to have him as a part of this event. And so we appreciate you joining us, brother. And we look forward to seeing you on more of these calls.
Thanks so much for having me. It's a real honor.
And that's it for me.
Dr. Miller, you want to show this last video?
Please. I think you or Anthony can share it, or just to close us out. We got to turn on your volume, sir.
And as Black health professionals,
Start again,
a higher
please.
calling. Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available, However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/love letter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
So although the focus tonight was on prostate cancer, we thought that message of love for Black folks and the role that Black doctors are playing in this fight was an important message for you all to receive and to emphasize COVID's still out there. And so it's just one of the things that we just need to continue to be aware of and be vigilant about. So with that, I want to bid you all a good night and thank you again for your time and attention. Back to you, Dr. Franklin.
Dr. Miller and our guests and panelists, it's my pleasure to moderate this panel tonight. I'm so excited for our work and the work that's ahead of us. And so please, if you don't, join us as we host Fireside chats throughout the year, monthly, to talk about those pressing issues that are challenging in our community. Health and wellness is important, and it's a lifestyle that we're talking about that will not only improve the quality of our life, but the longevity of our life in our community. So again, we thank you for tonight's panel discussion, and we look forward to sharing with you and joining us in the near future. Thank you. Good night.